The relationship of weather change and pain is very interesting. When you close your eyes, you know where your hands and your feet are because we have proprioceptors in those joints. So whenever you have arthritis, those proprioceptive joints become more active and you can feel the change in atmospheric pressure. So when my grandmother says that her pain is worse and she feels the rain coming, it's actually true, and which is why a lot of our patients kind of feel the same way. When the atmospheric pressure drops, those joints become more sensitized and the pain becomes worse. So I would expect you to have pain worse as we're getting to changes in weather. And as we head towards spring, whenever it's raining or whenever the temperature changes or oscillates significantly, which tends to happen in Jersey, the pain would be a little bit worse. How do we manage that drastic change? I think it's important to know the limitations. If it's going to rain, just know that the pain is going to be worse. So don't add more things on your plate to do that day. And obviously medications, interventions are helpful because they can help you manage the transition or the exacerbation of pain during those times. Struggling with pain is difficult. When you're in pain, you're angry, you're frustrated, you are expected to get up in the morning and completely fresh and live throughout the day. But that pain can get debilitating. You can go to sleep at night because you're so exhausted, and when that acute couple of hours you catch up on the sleep that's absolutely needed, you wake up at 3 in the morning and you're tired and staring at the ceiling and getting mad at yourself for not falling asleep. And all of that stuff contributes to the pain becoming worse the next day. So anxiety, stress, depression kind of goes hand in hand in pain. It's almost a vicious cycle that gets out of control if we're not aggressively treating one or the other or both. So having a co-management where you have a psychologist or psychiatrist, a counselor, along with pain management tends to work a lot better. But intervening faster and getting your pain under control sooner is probably the best way to approach it. So when you have pain that comes and goes, a lot of times it's difficult to find out what caused it to get worse. Was it the weather? Was it an activity? Was it something that you did that was out of the norm? And having a journal really helps with that. When you have pain that is limiting you from living your life, try to figure out what happened in the hours to that point. And that will help us guide you and try to find out what is limiting your ability to do things. We can intervene more successfully once we identify what the exacerbating condition was and what the situation was. And you can help also by not going through what may result in your pain getting worse. Therapy is important because a therapist can help guide you set up a program that you can continue doing at home. It's certainly difficult to go to a physical therapist 3 times a week, but I think it's important to do because they are standing right next to you, watching how you're moving, what your posture is, and they can help correct a lot of the different aspects that we have that we don't even know we're doing, or a lot of habits that we have that we don't know we're doing. And then once you have a program at home, you can continue doing that 2 to 3 times a day and give yourself that time. All of us are busy. No one really has time to give yourself some home exercise programs or undergo them, but they're for you and they're essential to stop the pain from getting out of control.